Dr. Sushant Swamy. I'm a consultant dermatologist. I'm practicing in Bangalore at Tulasi, the Skin Clinic. In this video, I will be talking about a very common skin condition known as tinea versicolor. What is tinea versicolor? Tinea versicolor is a skin infection that causes areas of the skin to undergo color changes. The skin might become dark or light or even develop pinkish patches. Now, tinea versicolor is caused by a fungus. This is a fungus that lives normally on people's skin and does not cause problems under normal circumstances. But in some people, the fungus can cause tinea versicolor. This happens more often in people who live in places where the weather is hot and humid. Even though tinea versicolor is caused by a fungus, it does not spread from one person to another. In other words, this is not a contagious condition. It is just due to an overgrowth of a normally present fungus. So what are the symptoms of tinea versicolor? Tinea versicolor often presents as a lot of small spots of color that seem to run into each other and form large patches. The colors can vary from white to light brown, dark brown, gray, black, or pinkish red. They can also be a mix of all of these colors. Tinea versicolor usually shows up on the back, the chest, the upper arms. It can also happen on the face or in places where the skin rubs together, such as in between the breasts in women and also in the underarm areas, less commonly. People sometimes also notice tinea versicolor manifesting in areas during summer which are exposed to the sun. And also these lesions tend to stand out more when one gets tan because these patches do not get tan. So what are the investigations, or how does one actually diagnose one with tinea versicolor? Most of the times, just a quick clinical examination by the doctor is sufficient to make the diagnosis of tinea versicolor. At other times, when there is some doubt, it's possible to use a wood slam to examine the patches, where one gets to see that there is a straw yellow fluorescence, which usually confirms the diagnosis. And of course, then there's also potassium hydroxide mount, where skin scrapings from the lesion are dissolved in 10% potassium hydroxide and then observed a microscope, which is where we get to observe certain fungal elements which are specific for tinea versicolor. So what is the management of tinea versicolor? Most mild cases of tinea versicolor only need to be managed using antifungal creams and antifungal shampoos or soaps. In this case, even the shampoo is used more like a soap. In cases where tinea versicolor affects a large part of the body, or if it is affecting a small part of the body but still does not get better with just an antifungal cream or an antifungal shampoo or soap, one might need to take oral antifungal medications. And this decision is usually taken either at the first or the second visit. So when we look at a lesion of tinea versicolor, we get to see two skin changes. One is that there is a change in the color, and also there is the presence of scales within those patches. So the success of a treatment is assessed by the disappearance of the scaling within these patches. The discoloration within these patches can take quite some time to resolve. In a lot of people, it can take anywhere between 4 weeks to about 12 weeks. So how can tinea versicolor be prevented? Well, tinea versicolor keeps coming back. One can reduce the number of times that one has tinea versicolor in a year by using antifungal soaps regularly. So that is about tinea versicolor. Thank you.